Hello, hi everybody. Welcome to your show, Political Landscape. We have this week Professor Michel Chossudovsky, and in a recent article named "The Killer Vaccine Worldwide, 7.9 billion people," he mentioned a very important subject regarding a report published by Pfizer, and he will talk to us today. It is a very strong message, very important message, and we invite you to share the information, the video. Hello, Michel Chossudovsky.
Yes, good afternoon. Delighted to be on the program.
Welcome.
Essentially, let me put it in a historical perspective because it's very important. The mainstream media does not inform us as to what is going on. The so-called mRNA vaccine was launched in early November 2020. And then it was implemented in different countries, pretty much starting in mid-December. Immediately following the launching of the vaccine, there was evidence of adverse events as well as deaths resulting from the vaccine. And I should mention that's from official sources. I should mention that the most recent data in Canada, we don't publish that data, but it's published in the United States, the European Union, and in the United Kingdom. But based on the most recent data, April of this year, there were 70,000 deaths and 11 million adverse events or adverse effects, namely morbidity, associated with the vaccine from its inception in mid-December. And that's for the United Kingdom, the European Union, and the United States. These figures are based on reported cases. And I've consulted scientific reports on that. And with regard to the frequency or percentage of reporting, it's a very, very small percentage, something of the order of 3% actually report adverse events. So that these figures underestimate the real impacts of this vaccine. But nonetheless, 11 million adverse effects is substantial. And so is 70,000 deaths in these, as I said, United Kingdom, United States, and European Union, where data is collected. Now, all of this is official sources. These are official sources, okay? We can't simply refute them, okay? We might refute analysis of what was the real level of mortality based on these estimates, which represent a very small percentage of the actual impacts, because only some 3 or 4% at best have been reported to the relevant authorities. Now, let me flash forward. Let me flash forward to the end of February. The Pfizer, which is the largest actor in this vaccine program, conducted an internal confidential report. They say confidential report, which extends from mid-December to the end of February. In other words, it's 2.5 months. Now, in the course of 2.5 months, they collected data from people who had taken the vaccine, and they came up with 1,200 reported deaths allegedly caused by the vaccine, and tens of thousands of reported adverse events. And that was conducted in a period of 2.5 months. And then there were cases of spontaneous abortions and pregnancies and reports of cardiac disorders and so on and so forth. But what I'm saying there is that that report was based on a period of 2.5 months, and it was then released to the public under Freedom of Information in October of last year. Now, people can consult that report. It's public. Previously, it was confidential. In the United States, the FDA had access to it. It was in negotiation with Pfizer and so on and so forth. But what I'm saying is the following. Based on that report, which is an internal document of Pfizer and which is now being made public, the figures and tabulations of adverse events, as well as mortality, should have led to the cancellation of the vaccine program. There was enough data there to corroborate the fact the vaccine is dangerous. I call it a killer vaccine. And it certainly is far more dangerous than the virus. I mean, that statement, which is repeated ad nauseum by the media, the virus is more dangerous than the vaccine. The virus is more dangerous than the vaccine. Absolute nonsense. Because first of all, the vaccine is similar to seasonal influenza. That's corroborated by scientific opinion. It's WHO's definition. It's the CDC in the United States. It's similar to seasonal influenza. But here we're dealing with mortality and morbidity on a significant scale. Now, what I'm saying is the following. Had the governments and the pharmaceutical companies acknowledged the initial data contained in Pfizer's confidential report, they would have, with a view to protecting citizens, men, women, and children, particularly children, they would have canceled that vaccination program because they had the data. And it wasn't a question of a peer reviewed by somebody who says, oh, no, they're dangerous. No, it's not. It is based on the report, the internal report of a major pharmaceutical company. And from a legal standpoint, it qualifies in that first instance between December and the end of February as a case of manslaughter, homicide, unintentional. We didn't know until we completed the study, and we're sorry. Okay, I'm obviously, don't take me seriously in all those words, but what I'm saying is that Pfizer knew that it was dangerous. The governments knew it was dangerous, but they did not take the decision of actually calling for the cancellation of the vaccine. Okay? They did not. And the following stage, we enter into a different context because inasmuch as the governments could have taken that decision to cancel it, it would still be manslaughter. But once they give their green light to the pharmaceutical companies and go ahead, do it, it becomes murder. from a legal standpoint. Okay. Now, if you take that Pfizer report into a court of justice, and we've gone through a whole process, the whole issue of constitutional rights is irrelevant here. We're not dealing with constitutional rights. The constitutional rights are important, but in this particular case, this is a toxic substance, and it has to be repealed. And the governments have the obligation to repeal it. They have the responsibility to respect people's rights, but they also have the responsibility to inform the public that this is a toxic substance and we withdraw it. Okay? It has to be withdrawn, and it would have to have been withdrawn by Pfizer. And so we're entering into another concept from a legal point of view. It's no longer manslaughter. We made a mistake. It's a deliberate intent to trigger mortality and morbidity. Now, maybe the governments have made mistakes. I'm sure they have, but I think that if they consult this document, which is there, and which confirms the impacts on people's health, cardiovascular, neurological, cancer, respiratory, gastrointestinal, and so on and so on. There are more than 1,000 adverse events which are associated with this vaccine. And what I'm saying here is that report of October, well, I'm sorry, it's not of October, it's of February, but it was released in October. And it's a bombshell. It's a bombshell, literally, because it not only it refutes, I mean, this is the irony, not only does it refute the narrative of the governments, okay, the official narrative, which is peddled by the governments and the WHO, which says, oh no, you must get vaccinated. This is the solution to the crisis, etc., etc., etc. No, it also confirms the medical analysis of numerous medical doctors, scientists who have revealed the devastating consequences of the mRNA vaccine. But what is of significance is that this is a Pfizer confidential report which provides detailed evidence on mortality, morbidity, and the data emanates from the horse's mouth, namely from Pfizer. Now, the question is, can this report be used to formulate legal procedures against Big Pharma, the governments, the WHO, and of course the media, but specifically against Big Pharma, which have misled us? And in a court of law, at least that's my opinion. I'm not a lawyer, but I would suspect that in a court of law, the evidence contained in Big Pharma confidential report, coupled with all the other official data that we have of deaths and adverse events compiled by UK, EU, US, etc., they are irrefutable. Why? Because it is their data and is their estimates, and it does not emanate from the critics of the vaccine. And what I'm also saying, of course, that this is not an issue of the rights of people to say, well, I'm not going to get vaccinated. And of course, those people lose their jobs. We're beyond that discussion because we are in the position to prove that this vaccine is dangerous to our fellow citizens, our children, and consequently, we require that our governments immediately seize and cancel the vaccination program. That is in a nutshell. I should mention, because it is relevant, that in the year 2009, Pfizer was accused of fraudulent marketing by the Department of Justice, and it is the only country, I'm sorry, it's the only company of the pharmaceutical industry which has a criminal record. Pfizer has a criminal record for fraudulent marketing, and that was announced. It was categorized as the largest healthcare fraud settlement in US history, and that was in 2009. It's on record. Now, how is it that our media never tells us that this major pharmaceutical company, which is involved in various corruption scandals and so on and so forth, in addition to that, had pleaded, they pleaded guilty to felony charges, and there was a settlement. It was of the order of $2.3 billion, not a negligible amount. And then there was also a procedure of consultation with Pfizer. They didn't actually arrest and imprison anybody, but they did impose what is probably equivalent to parole, or as you would say, that you're still under the auspices of the Department of Justice, and you have to respond to a parole officer, and so on and so forth. I won't get into the institutional issues behind this judgment, but what I'm saying is the following. Pfizer has a criminal record for fraudulent marketing back in 2009, yes, it was called an integrity agreement. An integrity agreement, that's what they put forth with the Office of Inspector General of the Department of Health and Human Services, so that they had to consult and make sure that they're going to be honest in the future. Well, they're not honest in the future. And what has happened with this vaccine does not compare to the accusations of fraudulent marketing, because it affects the livelihood of millions of people around the world. And in other words, I don't want to politicize this, but I think we have enough data and information to immediately call for the cancellation of this vaccine. And we also have enough information and material and concepts that the confidential document of Pfizer, which is now in the public domain, which can be consulted and should be consulted, confirms that Pfizer is responsible under, well, that's for the judges to decide, but I would distinguish between a civilian lawsuit on the one hand and a criminal lawsuit by Her Majesty. In Canada, it's Her Majesty. In the United States, it's the Department of Justice. But what we're dealing with has to be, first of all, resolved by the immediate withdrawal of this vaccine worldwide. And in as far as there are victims, there are millions of victims across the land in 190 countries worldwide, a process of a class action lawsuit to compensate the victims must be commenced, which will gather tens of thousands of victims in solidarity with one another against this vaccine, which is leading to numerous deaths as well as so-called adverse events. Well, when we say adverse events, I think it's a non-descriptive type of concept. It essentially is morbidity, what medical doctors call morbidity. You get sick, okay? Now, you take the vaccine and then all of a sudden you have cardiovascular problems, or you have a renewed cancer. All of this we can document because there's so many people who have been victims of this vaccine. But bear in mind that document of Pfizer is the avenue to confronting the pharmaceutical industry. It's a declassified document, okay? It's declassified and it's now available and we can look at it. And in fact, they wanted to retain it as classified for numerous years, you know. So there we are. Look at the declassified document. Declassified is almost an intelligence military concept. And there we have enough information to say that on the 28th of February of 2021, they should have put an end to the vaccination program.
Professor, we thank you very much for this week. It's all the time that we have. The message was really clear. We thank you very much. And I would like to remind to the auditor what you said in your article. You gave some recommendation to people and you said that do not get vaccinated. Stand in solidarity with those who have been vaccinated. Inform people across the land in your community on the health risk. Take a firm stance against the vaccine passport. So we thank you very much to be with us each week, and I would like to thank Lux Media and his team. Please be sure that you understand very well that these reinformation media are very important to let you know what is going on and inform you, and please don't hesitate to support us. You can follow our work on the platform www.stu-dio.tv, and it's many shows that we do each month, and they are all interesting. Thank you very much for being with us. Bye-bye.
Bye-bye for now.